Alright guys, this is Anatomy 1 Midterm Review Part 2. Okay? So we just finished up talking about most of the axial and appendicular skeleton, but now we need to tell the difference between the cervical, thoracic, and lumbar vertebrae. You look at the bodies. The cervicals have small bodies, the thoracic have medium bodies, and the lumbars have large bodies. The other way of telling it is the transverse foramen inside the transverse processes, and that's where your vertebral arteries go. They also have bifurcated spinous processes, and all cervical vertebrae, all 7 of them, contain these transverse processes. Even if we look at C1 and C2, atlas and axis, they're both going to have, where the string is going, vertebral transverse foramen. So the transverse foramen are here, and the vertebral arteries are going to be where the string would be. Okay? When we talk about the bones of the skull, we have the frontal bone in front, we have the occipital bone in the back, we have the right and left parietal bones, we have our temporal bone underneath that, and we have right here a piece of what looks like sphenoid. Now if we open up the skull, sphenoid is a very deep, dense bone. We have the greater wings of sphenoid here, the lesser wings of sphenoid here. This area here is called the sella turcica with the indentation called the hypophyseal fossa. We also can see right here the optic canal or the optic foramen, which is best viewed inside the orbit as the hole where the optic nerve comes out of the brain and goes into the orbit, where it attaches to the eye. Okay? If we look at here inside the frontal bone behind, in between the frontal and the sphenoid bone, we can see the sella turcica of the ethmoid bone. We have the cribriform plate that runs this way, and the holes of the cribriform plate called, the olfactory foramen. We can better see again the optic canal by going like this, and it does come out directly through the sphenoid bone. Very, very good. Continuing with the skull, we have some sutures to mention before we go over the more internal contents. We have the sagittal suture running in the sagittal plane between the two parietals. Along the coronal plane, we have this coronal suture running between the frontal and the two parietals. In the posterior, we have the lambdoidal suture, and we can actually see a little sutural bone or a vermian bone right there. And on the lateral, we can see this squamosal suture, the squamous suture, between temporal and parietal. Going back to here, the cheekbones we have are called the zygomatic bones, which makes the zygomatic arch, and the zygomatic arch is made up of the temporal process of zygomaticus and the zygomatic process of temporal. Our top where our teeth attach are called the maxilla. This is called the mandible. This would be the ramus of mandible. These are the mental foramen, but inside down here, that is the mandibular foramen along the inside. And again, this part would be called the mandibular condyle. This right here would be, mandibular condyle, and this right here would be the ramus of mandible. The mandibular condyle articulates with temporal, making your TMJ joint, your temporal mandibular joint. Where sound travels into our ear, that's called the external acoustic meatus or the external auditory meatus. This would be the mastoid process here, and there should be a little thing that sticks out here, but it's been broken off on this side, and that's called the styloid process. So we have the styloid process of temporal, we have the styloid process of ulna, and we also have the styloid process of radius. Okay? Looking over here at the bottom of the skull, we have the occipital condyles, left and right, which articulates with the first cervical vertebrae at the superior lateral masses. From here we have a hole, and this hole is the foramen magnum. That's where the spinal cord would go through. If we look here, we have the hard palate, which is divided into the maxilla and the palatine portions. If we look behind that, we can see the vomer. The vomer actually can sometimes be seen right here too, and not to be confused with the perpendicular plate of ethmoid. This would be the nasal bone. Right here would be the lacrimal bone. And again, the majority of the orbit is made up of a frontal, zygomatic, and temporal, with the posterior being made up of sphenoid. All right? From there, we did talk about the sacrum. The sacrum would be right here, and below the sacrum, we have the coccyx. Please don't get coccyx confused with coxal. We have this pelvic bone called os coxae, or the coxal bone. This is the coccyx, sometimes referred to as the coccygeal bone. Okay? Pubic symphysis is between the two pubic bones. I don't think you need to know the obturator foramen. We already went over the acetabulum. And I think that's it. Did I miss anything? Nope. All right, guys, that is the end of part 2 of our review. Good luck next week.